So you want to know or understand this question, and I'll try to walk you through the rationale as to why this answer is correct. So what we want to do is kind of pick and choose what information is pertinent to our patient. So I'll just read the prompt. It says you are dispatched to a residence for an elderly woman who is sick. When you arrive and assess her, you note that she is unresponsive to pain, only has hot, moist skin, and rapid, shallow respirations. You find prednisone. So prednisone is a key word here that we want to keep in mind, okay? So you find prednisone, Paxil. Paxil might be another drug that we might want to consider. And multivitamins on her nightstand. Further assessment of this patient will most likely reveal what? So I'll walk you through why an ECG evidence of hypokalemia is the right answer, okay? So prednisone, some of the side effects are increased urination and extreme thirst. So this clues me into the fact that this patient might be what? This patient might be experiencing some dehydration, okay? So with that being said, if this patient is experiencing some dehydration, that means that she's excreting a lot of electrolytes. Sometimes some of the other side effects are fever or cold sweats, which again alludes to the fact that this patient might be dehydrated. So with that being said, you would expect this patient's potassium level to be what? Low. So that already, without going into further details of how potassium is excreted, so on and so forth, would definitely want to basically put on your spidey senses, I guess, and clue you into the fact that this patient is hypokalemic. So any of the other answer choices don't mention anything about hypokalemia, so we could do a process of elimination and eliminate the ones that don't even talk about hypokalemia, okay? And the next thing is it talks about an ECG evidence of hypokalemia, and as I have shown to the right, there is a difference between a normal sinus rhythm with a patient with a normal level of potassium and that of a patient with a lower level of potassium. So with that being said, given the fact that dehydration causes an excretion of potassium, therein facilitating hypokalemia, so the patient will experience that. And basically I want to take you back for a second. I guess I didn't explain why this might be the case as well. Seeing that the question stem also states that you notice I think it was talking about a pill bottle. Yes. You find Paxil and multivitamins on her nightstand. You also find prednisone. So this is kind of one of those techniques that many paramedic or EMS instructors talk to you about, that you want to be cognizant of your scene, okay? So with that being said, you can use your critical thinking skills and take an educated guess that this patient might have overdosed on prednisone, Paxil, or some type of drug which caused this problem to arise. So if you have any more questions about the video, feel free to comment on it.